Thank you, Mimi, and we are on time, which is a good start. And we will move now from the ceremony to the content of the context. It's a great pleasure to introduce Professor Ilan Katz. Ilan, I think I may say, is a good friend and a colleague. He's coming from far away. He's now the director of the Social Policy Research Unit, right? That's the right name? At the University of New South Wales in Sydney, Australia. He's been working on the field of child protection for many years, started working on it in the UK, and moved to Australia and continued working on it. He's done some very well-known studies comparing systems and policies about child maltreatment and for child protection. And he will talk with us today about what is a good child protection system from an international perspective. Ilan, please.
Well, thank you, Asher. And firstly, can I start by thanking you for inviting me here today. It's a real pleasure to be here in Israel. Although my name sounds Israeli, I'm not Israeli. I've been here several times privately, but as I said to a few people, I've never worked professionally in Israel before, so it's a little bit intimidating that my first professional activity is to give a keynote at a conference, but I'm very pleased to be here. And also to acknowledge the context in which this conference is taking place. Very difficult time for Israel, but I think it's important for people like myself and my colleagues to come here and be with you at this time. And one more acknowledgement that what I'm going to be talking about today comes out of a number of research projects that I've been involved in over several decades, in fact. And so, although I'm not going to talk about them individually, I have to pay acknowledgement to colleagues who are working with me on these projects, many other researchers, most of whom are actually more intelligent and better researchers than I am. And I've learnt a lot from all of them. What I'm going to talk about, firstly, is the issues facing child protection systems around the world. As Asher says, my particular involvement is mainly in Australia. Can you hear me?
A bit closer.
Yeah, okay.
Maybe put a little bit more volume. Okay. Or you could take it
too low. Yeah. My involvement is mainly in Australia, the UK, and other English-speaking countries, but I have also done some work in Europe, and in fact, I'm doing work in China at the moment as well. I'm going to talk about reforms to child protection system and then some advances in how we understand and research the nature of child protection. And then I'm going to end off thinking about, well, measuring the effectiveness. How would we know what a good child protection system is? How would we measure that? So what is the problem? Firstly, research evidence indicates a fundamental paradox in the way child maltreatment is managed in developed countries. So there's a lot of research which indicates that prevalence studies show that around 25% of child maltreatment is never disclosed to authorities. Now I know Professor Scopus has done one in Israel, and I don't know the results in Israel, but internationally around 25% of child abuse is never disclosed to authorities. But on the other hand, child protection systems are inundated with reports, and in some systems up to 80% of reports to the child protection system are not substantiated. And this causes enormous strain to the system, firstly, but also means that it's very difficult to discover and identify those that have been abused. And also, many children report that when they are involved in the child protection system, far from that being a good experience for the child, the children who are involved often say that the situation is worse for them after they have been reported to the child protection system. Another issue is that in every country, virtually, minority and indigenous children are overrepresented in the child protection system. As I was saying yesterday, in Australia, the rate is 10 to 1. So for every one non-indigenous child, 10 indigenous children are reported to the child protection system in Australia. That's an extreme situation, but it's a very similar situation in New Zealand, United States, Canada, and across the world. And the child protection system is criticized for being too harsh on the one hand, in other words, taking children away from parents, but on the other hand, being too lenient, leaving children with parents, and often children, and occasionally, unfortunately, children are even killed by their parents who are known to the child protection system. So finally, for the child protection system, Hamatzav al Hapanim is what I learned yesterday. And this again shows that is a link between the child protection issues, maybe, and the political issues, that there are some very, very complex issues to resolve, both politically in Israel, but also in relation to child protection systems. Now, because of all these problems in child protection systems around the world, over the past 4 decades, there have been multiple attempts in virtually every jurisdiction to reform the child protection system. Right now, as we're talking, there is a massive reform going on in 2 Australian states, and New Zealand is also undergoing a significant reform to their child protection system. And there have been very significant reforms in the UK, Canada, and in many, many states in the United States as well. And these reforms include changes in the structure of the system, the function of the system, the scope, in other words, what they focus on, and what is defined as child maltreatment, whether the system is focused narrowly on investigation or broadly on support, and systems tend to move from one extreme to the other. Some centralize the system, and others devolve responsibility down to the local communities. And so these reforms tend to go in stages. And over these decades, the child protection system has significantly increased funding in many systems. So it's not, in terms of other welfare systems, a lot of money has often flown into the child protection system. But there's little empirical evidence of the effectiveness of the reforms. And a really key article in this respect was published recently in the British Medical Journal by Ruth Gilbert and colleagues, which compared outcomes in 6 child protection systems over a decade, and really found very little evidence that, firstly, of much difference between them, even though the systems were radically different from each other. The one, unfortunately, the worst system that emerged in terms of outcomes was the United States, and that is not because of the child protection system, but because of the availability of firearms in the States, which means that many more children are killed in the States than in other countries. But in terms of the systems, even systems like Sweden, which are held up to be the exemplar systems, when you actually look at the outcomes, they're not that much better than other systems. Now again, Israel wasn't involved in this study, so maybe things are better here. Developing countries are now beginning to institute their own child protection systems, and they're beginning to look towards the West as for examples of good practice. And going to what Yona said, Many developing countries, Indonesia and China and other countries who are developing, are now having to confront the issue of child abuse and are looking to the West for examples of good practice. But what can they learn from, not only from the good things, but from the mistakes of Western countries? Can we better understand and improve child protection systems at the system level? So although they're very, very good examples, and I'll talk a little bit about this later, of evidence-based practice and evidence-based policies in particular areas, and looking at the program today, there are a lot of examples that will be talked about today. When you take a step back and look at the full system, there's very little empirical evidence of what a good system looks like as opposed to a good program or a good practice. But what is a child protection system? So there are various descriptions of what the core components of a system is, but they all have to have, firstly, a legal basis on which the state or others can act to protect children and, if necessary, remove them. A process for identifying and reporting children who are suspected of being maltreated. Thirdly, somebody who's empowered to take action, or an agency, so there has to be an identified agency or range of agencies. And then there has to be somewhere for children to be protected once abuse has been identified. But is this because of the history, or is it an inevitable path? So one of the issues for developing countries is, do they have to replicate what is the child protection system in the West, or are there other ways of thinking about child maltreatment and protection that don't have these core components? I'm going to talk now a little bit about the typologies of child protection system. There's a history of research in this area. The main research has been conducted by Neil Gilbert. I don't know if he's related to Ruth Gilbert, who I was talking about before, but I don't think so, because the one is British, the other one is American. Neil Gilbert originally did his study in the early 1990s, and he identified two different kinds of child protection systems, what he called the child protection system and the family support system. And basically, English-speaking countries have child protection-focused systems. European countries had family support systems. Child protection was residual. In other words, children came into the system once they'd already been abused. It was forensic, which means it focused on questions of, does abuse exist or not? Is the child at risk? And risk-focused. It's focused on investigation and assessment, and focused on individual children, and dualistic, which means really the core question is this child maltreated or not? Family support systems, on the other hand, were more supportive. They intervened early, more holistic, focused on the family broadly rather than individual child, and multidimensional. In other words, they didn't focus only on whether maltreatment exists or not, but also on what are the issues, what are the concerns for this family. More recently, other types have been added to this typology, and they've taken into account individualistic and collectivist cultures. So I won't go into this in detail, but this is from a recent report we've done for the New Zealand government. What I'll talk about is the addition of the child development and the community care models. Community care models really developed by a guy called Gary Cameron in Canada, and is based on Aboriginal cultures where communities protect children. Child development is really looking at children's developmental trajectories and intervening at appropriate times to prevent poor outcomes. But each of these actually has got problems in and of itself. So although community care sounds wonderful in theory, in practice, some communities, and we were talking about this last night, and I think we might even hear some presentations, some communities, although they might protect some children, actually discriminate against other children, where the community becomes more important than the individual child. And so, although communities can protect children, they do not always protect children. But one of the problems is that these typologies are becoming increasingly inadequate to describe child protection systems. Firstly, Gilbert has done a follow-up study which was reported in 2011, and they found significant convergence in the model. So the European models are becoming much more risk-focused, and the Anglophone, the English-speaking models are beginning to introduce differential response and other responses for early intervention. So there's not such a dichotomy anymore. Also, these typologies really focus on the relationship between the state and the family, intrafamilial maltreatment. But now systems are dealing with all sorts of other issues, particularly also in the developing countries, such as institutional abuse, trafficking, exploitation, abuse by other young people, peer abuse, online abuse. And these issues don't fit in neatly into these categories of family support versus child protection. So the typologies are beginning to break down a little bit. Also, what's the formal child protection system, if you look at the legislation and the policies, that can differ considerably, particularly again in developing countries, from what actually happens on the ground. So UNICEF does a lot of work, for example, developing laws for different countries, but when you actually look at how children are protected, often the informal protection processes are much more important than the formal system. But the main problem is that they focus too narrowly on child protection system itself. More recent thinking acknowledges that child protection is not just about the operation of the child protection system, but involves a much wider range of different systems. So if you look from the child outward rather than from the system inward, you'll see that to protect a child, you need much more than a child protection system. You need the family, you need the community, and you need multiple agencies, including health, education, the justice system, the police system, etc. So reforms of the child protection system can only ever deal with a small component of the whole situation from the child's point of view. The child protection system also is not static. It's constantly evolving in response to external issues. In many countries, again, I'd be really interested to hear about Israel. The media drives reforms in child protection. Interestingly, in China, which is a very close country and one, as I said, that I've done some study, the media or social media in particular, has driven reforms in child protection. So although China is a very restrictive country politically and controls the media, it doesn't control social media around issues such as child welfare, and the government has had to respond to concerns. Also, the broader social protection system and the broader welfare system, which in most countries is becoming more and more restrictive, more and more punitive, and so the child protection system becomes part of that broader system. And similarly to changes in health, the criminal justice system, etc. So this is a little diagram of where the child protection system fits in. This is from colleagues Fred Wilkson and other colleagues who did a really influential piece of work for UNICEF on this broader idea of a child protection system, looking at health, education, mental health, status of children in society as a whole, and the goals that we're all looking for. So this is one of the paradoxes, that everybody is looking to achieve the same thing, but the complexities of the system mean that you have to go about it in very different ways in different contexts. So one of the projects that we have been involved in, again, was for UNICEF, and which is to try and move forward this idea of typologies. How can you conceptualize child protection systems and develop a typology that doesn't only focus on rich countries, but can be universal? And you can do it by looking at structural criteria, such as how centralized the system is, but it doesn't really address the nature of the system. Systems can't be classified along any one continuum anymore for the reasons that I've just said. You can't only look at how child protection focused or family focused the system is. And we realized that it involves balancing a whole range of different factors. So that includes, for example, on the one hand, giving more authority to professionals, balanced again against having more accountability in the system. And in many Western systems, in Australia and the UK, for example, over the years, the child protection workers have got much more and more paperwork, more and more accountability, sitting in front of computers maybe 50%, 60% of their time, rather than spending time with actually sitting with children and families. And so because of increasing accountability, their professionalism has been diminished. So that's one balance that has to be struck. Then there's this question of centralization versus devolution. Do you devolve the system down to local communities to run, which means that things will be different in different communities and possibly unfair? Or do you have one central system, but that means that it's not that it's not sensitive to the needs of local communities? Do you rely on formal processes and state intervention, or do you try and increase informal community-based processes? Do you have one central agency involved in child protection, or do you have multiple agencies, non-government organizations? We heard a talk about Holland the other day, where this is split up amongst different agencies, and so different systems have different structures in that way. Of course, there's always the dilemma of early intervention versus protection. Most recent reforms focus much more on early intervention, but there are people who question that and would like more resources to go into out-of-home care and child protection as opposed to early intervention. And then balancing the rights of the child as opposed to the rights of families, and that's always a very difficult balance to strike. So, and these are only some of the dilemmas that face policymakers in child protection, where it's not very clear or that you should go one way or another, that you have to balance considerations on either side. So when we tried to look at this, we felt that rather than look at these structural components, we would try and look at the essence of a system, which proved to be very challenging. And the first issue we confronted is whether the system has an individual focus or a collective focus. So that goes back to some of the first discussions that I had, whether you're focusing on identifying individual children either for protection or for support. So it's not about child protection versus family support, but it's about whether you focus on individual children or many societies which have a collective focus, looking at the community rather than individual. And secondly, whether it's more or less regulated by the state or other authority figures. So how controlled is the system as opposed to the system being very diffuse or diverse. And this is what we came up with. Again, I won't go into this in detail. And this is still a work in progress, I have to say. So it's not at the end. We are still thinking about this issue and trying to develop this theoretical understanding of child protection systems. But you can see that rather than having one dimension, we've got two dimensions: individualism versus collectivism, authoritarianism, permissiveness, and we've thought about these terminology. Permissiveness isn't a very good word in the terms of in child protection context. I don't know how to translate that into Hebrew, but you'll see that you have systems focused on in the left hand top, focused on identifying and assessing individual children, then the family support focus, strong provision of universal and targeted services, and then the permissive collectivism we've called, for example, emphasis on supporting communities to improve child well-being, focus on public health approaches, community development, media campaigns, broad-based mental health approaches. And what we came up with is that if any system goes too much in any of these directions, then it can become dysfunctional. And so each system, although we are not saying that you have to be in the middle of this circle, but each system has to choose in the context of that particular country and jurisdiction where in this circle would fit the best for their particular system. Now, the next stage in our project will hopefully be to try and actually road test this methodology and look at different systems around the world. But when we've consulted with experts, this seems to have made sense to them. And the point is then that you don't have a league table of child protection systems from the worst to the best, because child protection systems are not only objectively good, but they're good in relation to how they fit in with the context of that particular country. So here are some of the issues faced by child protection systems around the world. Again, it would be really interesting to hear about Israel and whether this resonates with you. So firstly, the rising costs. Expanding scope of child protection system, more children in out-of-home care means increasing costs to the system, and then of course governments don't like that, so they are trying to reduce costs. And there are many ways that they do this, and firstly there are significant attempts all around the world to reduce the number of children in out-of-home care. On the other hand, there are pressures to increase the age in which children are in out-of-home care because of concern that when children leave care at the age of 18, they're often extremely vulnerable and not protected. And so in some jurisdictions, the age at which children are in care has been extended to 22, 23, or 24. So obviously that increases costs, but it also increases the effectiveness of the system. But more and more, in more and more places, systems are looking for programs or policies that prevent children from going into care or get them out of care very quickly, including, for example, adoption. Then, as I said before, the overrepresentation of minority and indigenous children. It's an ongoing issue yet to be resolved in many jurisdictions. It's an increasing problem now with asylum seekers, unaccompanied asylum seekers, some of whom are within the out-of-home care system in some countries. In Australia, they're not. In Australia, they're in detention centres. And I think in Israel, I don't think they're part of the care system. Thirdly, every system is trying to shift to prevention, and sometimes by providing a differential response. But no particular response has emerged as optimal, and there's conflicting empirical evidence about whether differential response actually reduces costs and improves outcomes. So one argument is that differential responses when children are reported to the child protection system either go down a child protection track or a support track. But one argument is, well, that's already too late, that early intervention should come a lot earlier than when children are reported into the system. Multi-agency response, as I said, a recognition that the child protection system can't function without health education, but engaging those systems, and I see we've got people from pediatrics here, I see my colleague Frank, and others who are trying to get other professions involved in child protection. That can be a struggle, and it's not always their top priority. And then there's questions about the role of government, non-government organizations, and private sector provision. Again, how much of the system should be provided by non-government organizations? There's increasing tendering out of services in many countries around the world. That can be successful, but it can also be disastrous in some situations. Moving towards more positive themes, there's more and more focus on outcomes rather than outputs or processes. Particularly in out-of-home care, where rather than just looking at numbers and what's happening, increasing focus, and particularly with developments in data, which I'll talk about next, looking at, well, are we actually achieving something for these children? And then workforce issues. One of the recognitions more recently that reformers have come up with is that you can reform the structure and function of the system, but if you've still got the same people working there and the people are not adequately trained, then it's pointless trying to reform the system. So one of the reforms, and this is particularly in the UK that's been pushed forward, is to actually reform the organizational culture and training of the workforce in child protection. And I think Haruv and a lot of other people are involved in that aspect of it as well. There have been huge improvements in data and the increasing use of big data to go beyond providing statistics and look at trajectories through the system and system outcomes. And my colleague Aaron Schlansky, who's worked with some of you here, has really pushed this area forward considerably, and I'm going to show you a few slides from some projects that I'm involved in this as well. And then the emergence of evidence-based practice, evidence-based policy, and implementation science, which is the latest iteration of evidence-based policy. Implementation science comes out of the recognition that even if you've got an evidence-based program, if it's not implemented properly, then it can fail just as much, and particularly the challenge is taking to scale pilot programs. So another development in child protection reforms is policy transfer. So that is taking reforms from one context to another. And many of the reforms have been influenced by cross-national comparisons. So the colleagues who are here who have done that research have been increasingly influential where people have tried to learn from other systems. And the reforms have have taken place over time. The latest one, as I say, is around workforce and evidence-based practice. Now, reform can be energizing or enervating, that means the opposite of energizing. And one of the issues, and I've been involved now in several child protection reforms, is that although you can't keep the same system forever, these systems often become dysfunctional, but the costs of reform are often very considerable on the workforce. They can be very brutal for the people actually working in the system. So reform should not be taken very lightly. And every reform generates unintended consequences, and I've got this example of New South Wales is the state that I come from in Australia, where they did move towards a more prevention focus, and they already had quite a successful prevention program. And what they did then when they went to differential response was that families who were involved in this program but who were subsequently reported to the child protection system, well, of course, at that point, it couldn't be early intervention. So the program stopped, and they were now in the child protection system, and they often got no response at all. So this was doubly bad for the family. So reforms like that can have unintended consequences when you try and change the way the system works. So all Western countries are struggling to achieve better protection for children. Although it's tempting to believe that there is an optimal model for child protection system, I don't think this is realistic. Even if resources were adequate, child protection involves balancing a whole range of factors, not just related to the role of the state and the family. As I said, there's often unintended consequences, and many advances are fragile and can easily be reversed. Nevertheless, research and theory are improving the responses, and progress is being made. So I'm going to go quickly because I think I'm running out of time now to measuring this. Basically, there's two ways of comparing the system impact. Firstly is incidence, so changes in the number of reported cases. And then the other one is about prevalence, changes in the occurrence of maltreatment in the population. Each one of those has its problems. Incidence measures activity, not actual abuse, and prevalence is very hard to measure and measures other things other than the child protection system. Measurement, UNICEF has tried to compare systems in terms of child deaths, but actually child deaths are measured very differently in different countries, and it wasn't a very successful exercise that they had. And measures are often too narrow. They don't take into account the impact of children's involvement, nor the positive side of it. So it's very deficit focused. Then there's the dilemma of the technical dilemma, which Asher might be able to talk about, is whether you have multiple indicators or whether you combine them into one index and have a figure of child protection effectiveness, and that's an ongoing debate. So although assessing systems is still problematic, there have been significant advances in measures, and particularly technological advances in data linkage. So I'll just give you some examples. This is a map of New South Wales. This comes from an evaluation that we've recently completed of a whole system reform in New South Wales. And it looks at the amount of investment per child in each LGA's local government area in New South Wales, and then looks at the outcomes in terms of the reports to the child protection system, given the number of dollars invested in that particular area, taking into account about 200 or 300 other factors and other issues that were going on in each area. So a very complex piece of analysis done by my colleagues Rebecca Castles and Alan Duncan. But you'll see that some areas, the yellow areas get less money but do well. The blue areas got more money but did less well in terms of their changes. So when you've got the ability to link data sets like this, you can do some very sophisticated analysis which can help system reform. And here you see this linked to the funding as well. Then moving on, these are some slides, and I have to acknowledge my colleague Sharon Goldfeld, whose boss is in the audience here, and these come from her. So I'm moving from New South Wales now to Victoria, to Melbourne, and this shows, this is an index of deprivation in different suburbs in Melbourne, and then this shows children's outcomes as measured by the early development census, which I'm not going to talk about, compared to those, the socioeconomic status of those communities. And you'll see that, and this is at the level of the city, it's slightly different. So you'll see some areas where children do better than would be expected given their community socioeconomic status. And now this is drilling down to one suburb of Melbourne, and within that local area, the sub-areas, and similarly, this is the socioeconomic status of those different small areas, and this is how well children do in those areas. So using data like that, you can pinpoint, you can identify exactly which specific communities are doing well, which are not doing well, and where to intervene. So data can really help you in this area. So in conclusion, the theoretical and policy advances show that child protection systems are far more complex than previously considered. Understanding these systems as involving a series of trade-offs means there's no optimal child protection system. So I can't stand up today and tell you what is the best system in the world and what's the worst. And because child protection systems must be understood in the context of each society that they are developing in. Improvements in data collection and comparative research can contribute to global reform efforts, but information is not action. So I'm not saying just by doing this research we are changing things, but the research is the basis on which we can start acting to really change systems. And it's tempting, Asher said this yesterday, it's tempting to go back to the drawing board and start again and say, well, because of all these issues that I've just identified, let's just throw it up in the air and start at the beginning again. But unfortunately, radical changes could create more problems than they solve. So I think we're just left with slow progress, slow reforms to the system. And we can learn a lot from each other, but recognize that each of us has to respond to our own context and can't just bring in policies and programs from other parts of the world. And as I said, research and evidence are very important in moving this forward, but we should be very careful to avoid hype and unrealistic expectations. So every few years somebody comes up with an idea that X or Y type of program or policy or idea is going to solve the problems. If we have early intervention, it'll solve the problem. If we have everything was implemented properly, it's going to solve the problem. Each of these things adds a piece to the jigsaw, but none of them is the total solution. So these are some of my references, and as I say, many, many collaborators and others as well. So thank you. And I'd be very interested.